This is Health UnaBASHed, broadcasting live from HiMSS 2024 in Orlando, Florida on Healthcare Now Radio. I'm Gregg Masters, co-host and executive producer, and am joined by the digital health aficionado himself, author, editor, global thought leader, and steward servant, Gil Bashe. On today's episode of Health UnaBASHed, our guest is Tom Lawry, a top AI keynote speaker, a leading AI transformation advisor to health and medical leaders around the world, and the best-selling author of Hacking Healthcare: How AI and the Intelligent Health Revolution Will Reboot an Ailing System. Tom is the managing director of Second Century Tech and a former Microsoft exec who served as a national director for AI for Health and Life Sciences, director of Worldwide Health, and director of organizational performance for the company's first health incubator. Tom has also spent time in the startup world and has served as a health system executive and board member. And with no further delay, Gil, the mic is yours.
Gregg, I want to thank you for the gracious introduction and for all your hard work. We are here on the floor of HiMSS recording this show live, and I am with one of my favorite people, friend, and I think really one of the iconic voices and figures here at HiMSS, Tom Lawry. Tom, obviously, when it comes to augmented intelligence, artificial intelligence, amplified intelligence, however we want to define it or call it, really wrote the books. And as a matter of fact, one of the hot bestsellers here at HiMSS is a book published, I think, about 2 years ago, Hacking Healthcare, which is a must-read. It is a book I think anybody who is in the health field, whether you're interested in technology or information technology or not, is a must-read book. And I want to thank you for joining me here, as I said, right from the floor of HiMSS.
Well, and here we are at HiMSS talking. Thank you for those very kind words about the book.
One of the things I find when I'm at conferences or invited to speak myself at conferences is they all want me to speak about AI, ChatGPT, and Gen AI. And it doesn't make a difference what I really am speaking about, as long as I can weave in AI. To them, it's just like a wow, what a presentation on AI. And I'm wondering if you're experiencing a little bit of the same.
Yeah, well, now you have me chuckling. So we're here on the floor of the exhibit hall at HiMSS, which anyone that's ever been to HiMSS knows you can spend the entire day walking up and down the aisles and not see everything. So it's like the Super Bowl of information technology for healthcare worldwide right here. And it's funny because I love coming to HiMSS for many reasons, but one of them is if you want to know what the shiny object is in healthcare, all one needs to do is walk through this exhibit hall each year, because whatever's plastered on everyone's booth it is the shiny object that everyone's trying to package and sell around. And guess what? Generative AI is the shiny object now and probably will be in the foreseeable future, which is great in some ways, because it's getting everyone attuned to the power and potential of AI. And yet, we were talking about this yesterday in the AI forum. There's such a problem right now with generative AI in general, in what I call the signal-to-noise ratio. There's so much hype, there's so much chatter. It's getting in the way of having real conversations about, the viable use cases, the path forward that everyone's trying to figure out when it comes to using AI to make healthcare better. And I don't know that, we will figure it out. If you go back to the Gartner hype cycle, where the last time I looked, generative AI was at the very peak of what they call inflated expectations. And anyone who knows the Gartner hype cycle knows the next stage is what they call the trough of disillusionment, which every time I hear that, I think someone from Monty Python must have worked at Gartner for that term. So we're going to probably see what Gartner predicts, which is all of a sudden a little disillusionment, which frankly is not going to be a bad thing, because maybe then we can get down to getting some of the noise removed to start looking at how are we going to apply this new and emerging technology to do good.
You know, you're touching on a very sort of a sore point for the health system. So people latch on to the shiny, but the hard part is operational. How do we take these technologies and look at what elements of the health system could really benefit through their application. You've been involved in that part of the process for more than 2 decades, sort of exploring how information can change the quality of care we deliver. Obviously, technology has now become a big part of that, but from your experience of really working with hospital systems, with innovators, obviously you were part of one of the great innovators around information, Microsoft, for many years. Could you share with us some of your sort of gleanings of knowledge when you're looking at the more progressive health systems that are saying to you, Tom, help us better understand how we get practical about the application of information and what we used to call way back when, after big data, then we graduated to machine learning. So now
okay, there's a throwback. So
yeah. I remember we're collecting big data. People would ask me, what's big data? I'd say, it's a lot of data. And now, of course, we're in this new term. It's really just a combination of the first two terms, I think.
Well, okay, you're going to get me way off track. But no, back to, there was a time where walking through this hall at HiMSS, everyone sported big data on, their placards. And when was the last time you had a big data conversation? It's like, data's data. I used to kid about if there's big data, is there grande data, is there, small data. It's like data's data. And we've got increasingly better tools to grab and use that data to do good. But anyway, back to your question. Again, I had the privilege of working at Microsoft 15 years in some really amazing roles. Amazing in that, I had the privilege of working around the world with healthcare leaders, healthcare organizations on analytic and AI projects long before it became popular. And so in my experience, oftentimes I'd go into a organization for the first time and I'd start working with them. And there are certain things that if they were in place, I would look at and say, when I come back, say 2 years from now, which organizations are really going to be creating that dynamic innovation flywheel with analytics where they truly are transforming at scale and driving measurable value? Versus which ones are telling me about their 1 or 2 limited use cases in machine learning or AI today. And when I come back in 2 years, I'm mainly going to hear about the same use cases. And the netting it out, the technology vendor you choose is almost irrelevant, which is not to say it's not an important decision. But if you pick the right vendors that have technological capabilities, that doesn't drive value on its own. Value starts when you're using that technology to drive process change, so clinical operational workflow improvement, the things you care about, the things that are part of your clinical quality goals, your operational efficiency goals, your mission on patient experience. And when you look deeply at the companies that do that right and drive that value at scale and create that frictionless flywheel, it's what I call the leadership imperative. They get the fact that driving change and innovation is about having an innovation of culture. And everyone talks about we're innovative, but if you look at which organizations truly drive innovation as part of their culture, which means it goes up and down the line, those are the things. Or it's things like right now, with everyone talking about AI and generative AI, I think the number one future of work issue affecting particularly clinicians, doctors, nurses, is, the impact of AI as it comes screaming at us. So one of the things I often talk about, back to your question, is within leadership of any organization or anyone listening today, to be able to say, if you're gung-ho on AI and you've got your CTOs and others working on it, here's the question, because it relates to scale. Is AI part of your HR plan today?
That's a great question.
Because if it's not, you're already behind. The investments you're making may produce some use cases. It won't produce value at scale. So I often see organizations get very organized around AI. They've got the C-suite, the top 200 people in their organization calibrated, the budget committee prepared to make investments. And then they've got 20,000 people below them, the doctors on the medical staff, the nurses, anyone who's a knowledge worker, who is driving home or taking the train home at night, and their main question is they're seeing what's happening in the organization and the announcements, and their number one question is, what does it mean to me? How does it affect how I'm going to work in the future? And those are the issues that when you start addressing, that's when magic happens over time. And I could go on and other things. Another big area right now is as history shows, when innovative technology comes along, it almost always gets out ahead of regulators. So as technology gets out ahead of regulators, as it has today with Gen AI, we have a real responsibility as regulators eventually race to catch up and put guardrails in to say, what are the ways in which we are going to use our new creations responsibly? And so everyone loves to talk about responsible AI, but when I ask the simple question of any organization in healthcare using AI today, have you developed or adopted a set of responsible AI principles at the leadership and board level, number one? And if you haven't, how do you possibly know you're using that technology responsibly? And then if you have adopted it, the next question is, are you applying that with each and every use case you're putting into play, such as an algorithm, such as Gen AI? And these are the things that when leaders pay attention, they're the ones that develop true competitive advantage. When they don't, they get a few years down the road, and then someone starts questioning the return on investment. And it's not the technology. It's really that leadership imperative of how you drive change using AI.
Just dropping in? You're right on time for Health UnaBASHed on Healthcare Now Radio. We're chatting with Tom Lawry, author and leading AI transformation advisor to health and medical leaders around the world. He's also the best-selling author of Hacking Healthcare, How AI and the Intelligent Health Revolution Will Reboot an Ailing System. Stay tuned for the rest of the story.
I'm thinking back at the time, sort of the Socratic method, and where people were recognized for their pattern recognition skills. And great strategists really were able to connect dots or see patterns. And they became perhaps prophets or soothsayers or futurists, as we call prophets today. And these were people who were able to sort of like intellectually collect and retain vast amounts of information. And in medicine, they became the great diagnosticians. And so they had organically built in their own augmented intelligence intellectual system. AI is really institutionalizing the sense of this wealth of information of people who have pattern recognition. And now, in a way, it's democratizing quality care, or it has the potential to take, let's say, pathologists or radiologists who are really good, but they're getting now the finer points of the data thanks to augmented intelligence being synthesized for them, and they're getting the opportunity to be directed toward things they may not have seen in the initial analysis under the microscope or on the light board. AI is giving them that capacity to sort of double check and say, did I catch everything? Have I offered all the potential insights? I certainly think AI is a stress reducer for the person who understands. It's complementing their knowledge. It's not replacing their knowledge. We still require human wisdom. But you said something which I think is important, which is, the 200 people involved in the AI discussion in a large health system may get it, and then the other 10,000 who have to implement, it's like, I don't know. I give the example often of my late father-in-law, who was a great physician's medical records, his EMR, where he was judicious in personally making sure as a physician all of his data were up to date. And when I spoke to a nurse on the floor caring for him his last 12 days, and I was speaking to her about the EMR, and she said, I don't have time to read the EMR. So on one hand, we're collecting data. We have brilliant people, he was a great diagnostician, who are synthesizing it in a way that it could be readily understood and applied. And yet it comes down on the bottom level. It's still about humanity. I'd be curious, this sort of tension that exists between the power of information technology and information management, and yet it comes down to personal behavior. What are we going to do to sort of like find some harmony between our advances that we're making constantly and collecting and processing information, and then we're just dealing with people who are overworked on hospital floors, and they're just trying to run and answer call buttons and buzzes that are going on incessantly in the hall?
Gil, there's a lot to unpack in what you just said. First of all, I think you did a great job of really explaining the value proposition of AI at a fundamental level. So, think about it. The brain is such an amazing organ in humans that we've gotten to the point where it's figured out how to outsource certain things that previously only the brain can do, which is what we call AI. And the idea is, if you understand what AI is good at, better than humans, things like pattern recognition, being able to process vast amounts of information, and then you bring that in behind what's uniquely human, particularly in clinicians, that's part of the care process, which is wisdom, experience, empathy. It's bringing those two things together and bringing AI in service of those clinicians that make them better at what they do. The second thing, as you were talking on, the diagnosticians, so think about this. A newly minute physician in 1950 would go their entire career in practice, 50 years before medical knowledge doubled. Today it's doubling every 72 days. So think about that for a moment. You can be the best physician coming out of the best medical school and residency, top of your class. And a couple of months from now, there'll be twice as much information to deal with in decision making and sorting through it. And many people that I talk to refer to that as a problem. And I think, with the right tools, what an incredible opportunity to have all this information coming in behind us in better service of patient care, of research, of drug development. But it brings us back to your point of, we've gotten so good at the quest for more information to do good, we have another problem, which is it's going beyond the human capacity to deal with all of it. So our ability, again, to bring AI in behind it, to make you better at sorting through all that information, to help have AI help augment by looking for those patterns, by teeing up plausible diagnoses, not for AI to make a diagnosis, but to give you more information as that human, with your experience, with your wisdom, with everything you have, to make a better decision. That's the value prop of AI for clinicians. And then there's one other thing while I'm on this role. So, there's lots in the clinical literature about how cognitive burden can adversely impact quality, satisfaction. So that's one of two things that AI is really good at that's helping clinicians. The other is when I look at, there's a lot of studies today, including my favorite out of Stanford, that shows many doctors in America spend more time doing administrivia than they do seeing patients. So think about that. You went to medical school, you went to nursing school, and we've turned you into basically a data entry clerk. So it's one of the leading areas that is also causing, what we call burnout, which I think is way too polite. We need to call it out for what it is. We have a system that has a mission of health and healing that is harming the very people in short supply that are there to care for all of us.
And ultimately the patient, people used to say, the patient is the customer of the health system. I'd say, not at all. The system is the customer of the system. And the system is at the center of health, not the patient, certainly not the providers. But, I'm thinking of what you just said, and I'm realizing that as we were chatting aside, Forrest Gump, stupid is stupid. And Saul Wertzman, who founded TED, Technology, Entertainment, and Design, wrote a great book, it must be at least 20 years ago, called Information Anxiety, where he talked about we're being bombarded with vast amounts of information. The concept of artificial intelligence, machine learning, was to enable us to synthesize and see the connection among data points, patient care points. So I understand how we've gotten from this information anxiety period to what our friend John Nosta calls the age of cognition. And you bring in an element into this, which is you understand that health professionals, nurses, physicians, administrators need to be trained of how to effectively use technologies to accelerate their workflow, ultimately to improve care and the financial stability of the system. You're one of the few people who connects the humanity of this health setting with the technology that is designed to accelerate they accelerate and enhance people's ability to be part of the system today. Problem? Doctors get little to no training during medical school on any technology. Maybe they get a class or two, maybe, on how to survive EMRs, but I'm amazed that they get physiology, biology, practical training. But don't you think technology, information technology, should be woven in now to the medical school curricula?
Once again, Gil, so many things to unpack in what you just said. So
I always ask 15 questions.
Yes, no, you are clearly getting value out of a 30-minute show. So, so I recently, and I'll just say, I was asked to do a presentation of the board of one of the largest associations representing nurses, and I was asked to be somewhat controversial. I thought I was very mild-mannered, but one of the things I said that I don't know if it's set well is this. If nursing school curricula do not include basic training in things like analytics and AI, we are graduating nurses that are not prepared for the future, probably not even prepared for present day. Same with medical schools. And so I know there are some schools that are now offering like a master's in informatics in addition to your MD degree. And to me, that's a good start. But fundamentally, these are going to be core skills that anyone's going to need to have, which gets me back to, if you're a healthcare organization today, is AI part of your HR plan? And that's everything from skilling, reskilling, to the ways in which you write your job descriptions and are recruiting new employees that help you create that culture of innovation. The other thing, coming back to what you were saying about the balance between productivity and humanity. So there are a number of studies that show, for both doctors and nurses, that properly used, and emphasis on properly used, AI has the ability to eliminate 30% of the work of physicians and nurses today. Now, we're not talking about the high-value things. We're talking about those low-value, highly repetitive things that are taking them away from being doctors and nurses. So imagine a process. We could wave a magic wand, and I could go to a physician or a medical staff or a nursing staff to say, what if I could give you 30% of your time back? What would you do? If you're a doctor, that may mean I can actually spend more time looking into the eyes of my patient in the exam room. I can spend my time doing more research, or God forbid, I could actually get home for dinner with my family more often. So it gives us the ability to not only improve the system on productivity, but hopefully start returning these clinicians who are feeling very worn out to get closer to that intrinsic reason they decided to do what they do. I mean, I talked about this in the Nursing Informatics Forum yesterday, where, there's a point that as a nurse, you came to a point in life where you decided you wanted to be a nurse. You didn't decide you wanted to be an investment banker or a lawyer. You decided you wanted to be a nurse. And it's like, how do we get you back to, or restore you to, those intrinsic reasons that you chose this profession? And I think everyone's talking about AI when it comes to productivity and efficiency gains and financial performance. I'm here to say we've got to solve for this thing that you keep referring to as the humanity of health and medicine. It's like restoring our clinicians, our knowledge workers, to let them be what they want to be, play to the top of their game. That's how we're going to restore not just them to being excited about being what they are doing. It's going to make the system better across the board. Patient safety, quality, efficiency. But it's, I think we're having a lot of the wrong conversation, and I'm a big proponent of, like, as people walk the halls today, the conversation about AI, I think in many ways is the wrong conversation. AI is not about technology. Done right, it's about empowerment. And that's the conversation we should be having, whether it's, workflow, whether it's how do we bring it in behind any knowledge worker to make them better at what they do.
I always, first of all, I think you're spot on. And I think that you're setting up the desired endpoint of how technology can empower people to be to rise to their greatest potential. And that really should be the responsibility of leadership. Absolutely. I think the health system, with leaders like that, would do a much better job caring for people who turn to healers to be healed. I think the challenge we often face, and I'd love your last words on this, is how do we make leadership comfortable enough with the vision of how this wave of innovation can help their staff rise to a higher potential?
Well, I think the short answer is leaders need to lead. Leaders need to understand what they must do differently to be leaders in the digital and AI world. And there's some great research coming forward with groups like Gartner to say, you know, you can be a very successful leader in the past. In the new world of digital and AI, there are new hard and soft skills that you need. If you possess those, you're going to be much better able to lead in this new era of digital and AI innovation. And if you don't have them, you know, chances are you're not going to do so well. You're not going to be the leader that I would want to be getting behind.
Well, by the way, Tom, I think that closing statement was an amazing statement that people should actually look at in terms of what sort of leader am I if I'm not embracing AI or ChatGPT or Gen AI, thinking about it. Am I qualified to be a leader in the health system?
Well, and Gil, I would just say, every organization that I know is talking about it. And as you know, there's a difference in talking about innovation with AI and then driving innovation. It gets back to the earlier part of the conversation. It's not about technology, it's about so many other things that good leaders understand and they lead on. Culture, drive, the ability to help manage an organization through change. You know, what a lot of people are talking about, which I think is critical, which is organizational ambidexterity, where you must be able to keep the boat afloat efficiently for the way the world is today, but you must start planning, have a line of sight for where we're going and how you're going to get there.
Beautiful. Tom, you know, thank you for coming back onto Health on Bash for a second time, but I think in this conversation, a third time will be a charm. Thank you,
Gil,
very much.
anytime you ask, I'll be there. Thank you, and thank you for all of your work to champion what you do.
Oh, you're welcome. And thank you to Gregg Masters, who are our executive producer. Gregg, thank you so much for making this possible.
And that, dear listeners, is the last note for today's melody. A huge thank you to our worldwide audience for tuning in. And a tip of the hat to our guest, Tom Lawry, a top AI keynote speaker, a leading AI transformation advisor to health and medical leaders around the world, and the best-selling author of Hacking Healthcare, How AI and the Intelligent Health Revolution Will Reboot an Ailing System. Do follow Tom's work on the web at www.tomlawry.com and on Twitter via @TCLawry. That's Lawry. Health UnaBASHed streams live 3 times a day on Healthcare Now Radio, Monday through Friday at 10:30 a.m., 6:30 p.m., and 2:30 a.m. Eastern. Stay social with Gil and me on Twitter via @Gil_Bashe, and that's BASHE, and Gregg Masters MPH, and that is Gregg with 2 G's. And don't forget to give your tweets some zing with our hashtag Health UnaBASHed. Until we meet again, pursue your passion for better health with no apologies.